Hi everyone, I am Dr. Ramesh from Cessna Lifeline Veterinary Hospital. Today we have a 9 years of golden retriever who is having one ear hematoma, and we are doing ear hematoma surgery to treat it. So what usually I do is I do cut the skin of, usually I don't give cut with the cautery, but for the ear hematoma I give cut with the cautery only. Can you see he is a little reacting? He is reactive. Can we give infuse anesthesia? So this is fluid is coming out, but if the dog is reacting, we'll just wait for his anesthesia to kick off. So advantage of giving a cut with the cautery is we don't see too much of bleeding while suturing. Otherwise we don't want this area to heal too fast also. So we can use the cautery for this also. Then we lift it and we try to curate it. We freshen the area. This is a very acute case, so not much fibrin deposit, but normally what we usually see is lots of fibrin deposit. And then I am going to make some small cuts on the cartilage area so that the adhesions forms faster. I am removing few areas of cartilage so that freshening both the edges, both the side of the skin. I am not removing complete cartilage, but I am removing in between smaller areas. You can directly scrape it, or you can just cut it like this. You can cut it like this, smaller area. So either way we can do. Okay, so this is what I have done now. Now we are going to start suturing. We are using 3-0 nylon, and few things we always take care during the suturing. So first we need to check up to what level, how much area we need to suture, and I evaluate before itself. So now I know which areas to be sutured. I am taking other side skin, I am taking half bite. So the assistant has to always keep this area flat so that we don't get any wrinkle. It should stay flat like this. If I try to tighten it more and if nobody is holding, there will be wrinkle formation. And when we are putting the near the edge, we need to keep the edge close to the other side, close to the other side. So what I am doing here, I am just checking this area, it's coming here, and then I am just bringing this edge a little closer, and then I am taking this bite. There should not be too much gap left at the end. Again, in between we have to check which area, how much area to be sutured. So I am just taking my bite from here to here. Sometimes I put 3 layers if bigger area is involved, sometimes I put 2 layers. Again, I am just going to check here, it's till here, till here. So just keep cooking. And if you see here, there won't be any suture coming outside. So this all sutures go inside. just keep pressing this area. There is some small bleeder is there, which will get better in some time. So wherever we feel that gap is there, we just apply these sutures. I put all these knots are all slip knot I am putting. It's for me it's easy to um, keep it tight according to my way, because in other knots you can't maintain the tightness like this. So I prefer to put slip knot, but slip knot always challenging sometimes. So you need a practice for this slip knot, but it's a doable thing. It's not something which is very difficult and all. If you practice for 10 days, you'll get used to it. So you can just see that I put these two sutures there now, the two scare knot, simple knot, and I am pulling this one. You can just see that it becomes scare knot. Again I am checking this area, how much depth is there, till here, so one suture I will put it here. I think I am keeping it a little loose. While removing these sutures, it's very easy to remove because they will not be tight and they are not going inside the skin. Sometimes I have seen these sutures going and piercing inside the skin through and through. Okay, that's all. Saline. Now we are going to wash the ear with the saline and then we are going to dry it. Can I get a towel? Sterile towel. Towel. The sponge. We can dry this with a sponge also, or with a dryer also little bit, because sometime if it stays wet it create problem. Otherwise we can just do, and in case if you have small bleeders for 5 minutes we can just keep pressing this area and the bleeding will stop. 20 have you given, Tracy? So this is the sponge which we are using, and this the cloth side should be outside and this sponge part should be inner side, and we buy from Happy Pet company. It's I think Bombay based company who supplies us. So if somebody wants to use this, you can check on online probably. This is the Buster company name. I can just show it here. So this is the Buster company which we are using, and the supplier is Happy Pet. So if somebody wants to buy, probably you can buy from them. So now we are going to just place it in such a way that whole area get covered, and extra piece we are going to just cut it, extra part. Just keep holding it. I am using 20 nylon to suture this, but these sutures I take through and through completely. I am making a little tight, but we should not make too tight also. It can again create a problem with the blood supply, and all the sutures we should put as a vertical sutures only. Keep holding tightly, but there is some bleeders still there. Holding tightly from this side. Keep holding this area tightly. And we don't do any dressing, we just put a e-collar and pain management, and one course of antibiotic we start, and that's all what we do for as a post-operative care also. We don't do too much. most of these dogs will be having ear canal infection or ear infection, so we have to treat that simultaneously. So if you see, only these 4 sutures has come out, rest of sutures are all inside only, nothing is outside, and this the extra portion we are going to just trim it. That's all. So this is all about this surgery. That's all.